Well, we're happy to be here in the lab today. We brought the whole, well, not the whole, but most of the leadership team down. Josh, Flo, Colleen, Tiff, and Matt are here. And it's a special day. So yesterday was Doctor's Day, which I didn't know actually until someone reminded me in the morning. And we're one day late on this, but that's okay. Today for Doctor's Day, or to day after Doctor's Day, we want to celebrate the NIH Physician of the Year. Oh, I can take my mask off for this? Okay, I've been vaccinated, everyone. So we've been doing Physician of the Year for several years at Flagstaff Medical Center. Speak up still? Okay. And this year we changed it and we're doing NIH Physician of the Year because we're a system and we want to recognize physicians who work across the system. You didn't have to be a system physician in order to win, but it just so happened that that was the case this year. And we'll say a few things about him here in a second, but let's go ahead and present Dr. Michael Papez, star pathologist, Northern Arizona Healthcare Physician of the Year. Smile. He's smiling on you there. And we're going to make him talk in a second, which I know he doesn't want to do, but he's going to do it. That's why people go into pathology. You hide them in the basement. They don't have to talk to anybody. This is well-deserved. So we've done a couple things. Lainey and I spoke to the newspaper yesterday. So get the newspaper tomorrow. Yeah. So I think the important thing to recognize about Michael, and I think a lot of people here have nice things to say about Michael. I know Colleen for sure does. You're her favorite doctor. She just can't come to see you. The thing about Michael that I think sets him apart from most physicians, he is one of the most humble people that you'll meet, right? He comes to work every single day. He works his tail off. He'll be here till extraordinarily late hours, knowing that at home he has 5 kids that he still has to go home and do dad stuff that he does as much as anybody does. And they all support him, and he's here taking care of our community. And I think that gets lost a lot of times on pathologists. People don't realize that a doctor like me or my wife can't do our work without the work that Lainey and Forrest and Michael and Darlene and Harold do. It's important, and I guess Ted as well. Oh, he's over there. That we need you in order to give those diagnoses to people, to understand the lab work that we have, to ask you what we should order, to make this whole place work. And that goes for the entire lab. And this lab has had struggles, but it's coming up. And I think we all need to recognize Meredith and what she's done. But during that time where the lab was struggling and Matt was looking for leaders to help make it better, he led the whole time. He did things that no medical director in our system would ever or has done on an administrative level, taking care of staff, dealing with HR issues, and then would stay till 10 o'clock at night to read slides so that patients had diagnoses. And you know how easy it would be as a physician to say, you know what, this work can wait till tomorrow because I'm not really accountable to that patient. I'm not walking in their room tomorrow and telling them what their diagnosis is. But that's not how Michael or Lainey or Darling, nobody thinks that way down here. You get the work done because that work is really important to that person who's sitting there and waiting and worrying. And so it's really important. He knows it. The pathologists all know it. And for the rest of the lab to know that that work that you do is so integral to how people are cared for, and what they sit and worry about is dependent on what you do. And he ran it like a boss for a long time, and he still does. And it's been a really hard year, right? It's been COVID, and just like all the doctors across the organization, everyone stepped up. But what I told the newspaper person yesterday was he's been stepping up every day for 10 years. And that's just when he swabbed everybody in the lab because we didn't have enough employee health people that day to do it, and then stayed late to do his work. That wasn't because he wanted attention for COVID. No one would have even known that if someone hadn't told me. He did it because it was part of his work and he was taking care of everybody, and then he still had to get his work done and take care of patients. So yeah, it's been a tough year, and yeah, everyone stepped up for COVID, but Michael steps up every single day. And I think everybody down here knows that. And I think it's time everybody recognized how important Michael Papez is to our system, and that we would not have a lab or a hospital system that runs without the work that he's done over the past several years. But I think it's also important for a physician of that caliber to be recognized by everybody. So, Michael.
Thank you, everybody. Derek's right. Pathologists aren't used to making speeches or seeing daylight and things like that. So I should like to thank first and foremost the lab professionals represented here in this room. Derek's right. It's been a crazy ride for several years, and the last year in particular has been extraordinary. So we stepped up as a lab to care for the patients, drawing at the bedside, running these analyzers, and getting physicians what they need to care for the patients, and hopefully peace of mind for the patient that those are good results that can be trusted. And I know it's true because I trust them. So in many ways, it was a pleasure to be at the head and overseeing a group of fine people. So thank you all for that. And Derek, thanks for all the kind words. I'll try to live up to them going forward. And
it's a speech, like half of it was true. It's good.
Exactly.
So, and thank you to senior leadership and NIH. I do think over the last year in particular, necessity has really driven us to be more of a system. I don't know, that's been a goal, and we've been working toward that for many years already. And it's really nice to see that when it's needed, it's been in place, and also given everybody the chance to see the opportunities that arise from being a system too. So thank you for that. I'm very honored to be recognized by my colleagues, and I'm very proud of the labs at FMC, VVMC, and Sedona. Very proud. I don't have much more to say, so thank you to everybody.